calculates the daily death figures from coronavirus. Let's get more from Sky's Rob Powell, who is in Downing Street this morning. What's this all about, Rob?
So this is about how Public Health England calculates who has died from coronavirus and whose deaths get added on to that tally that we've grown used to seeing day by day, that currently stands at around 45,000. Now, the issue is that the way it's being counted at the moment means that if you are diagnosed, you test positive for coronavirus, even if you go into hospital, but then you recover and you come out, and then 2 months later, say, or a period of time later, you then die of something completely unrelated to coronavirus, your death will still be added to that coronavirus death tally. So the example that was given to me by a government source was basically if you had tested positive in February for coronavirus, you'd recovered, you'd been fine for the last few months, but then you'd been hit by a lorry or hit by a bus yesterday and died, your death would still be added on to that coronavirus tally, even though clearly, even though you may have had it, clearly your death is nothing to do with coronavirus at all. So essentially what this means is that tally that we've been used to getting from the government every day when they are updating us on death figures is likely to be out, is likely to be too high, which means that 45,000 figure that we are currently looking at in terms of deaths from coronavirus is likely to be wrong. Now, this doesn't affect when you're looking at excess deaths, a different way of counting deaths, and this doesn't affect the data that we get from the ONS. There's a couple of different sources of data for coronavirus deaths. The ONS figures are likely to still be accurate, but in terms of the actual count that Public Health England and the government rely on, well, that now looks to be inflated. So this urgent review has been ordered by the Health Secretary to basically try and sort out this issue and to try and establish actually by how much they have been overcounting their deaths. Hugely embarrassing for the government, especially after some of the ordeals that we've seen in terms of counting test data. It now seems that arguably the most crucial figure in this whole coronavirus pandemic, how many people have actually died from the virus, the government's own figures could be way out.